Now that we know how diseases spread amongst a population, we're going to have a look at how we can actually prevent or limit the spread of these diseases. So, our learning intention for today is that we are going to examine the factors involved in the spread and control of outbreaks, as well as discuss their ethical implications. So, the more that we understand how a disease causes transmission or how it is able to spread from people to people, the better that we can use things such as sanitation and healthcare to help us control the spread of it from different people. Things that can contribute to disease control, though, are displacement of populations due to maybe armed conflict, natural disasters. So think about tsunamis and things that are going to wash away and really decrease the sanitation of an area, as well as lack of food and water, because obviously someone who's malnourished is more at risk of getting a pathogen as opposed to someone who is more healthy. And of course, we have our key organization here when it comes to disease control, and they are the World Health Organization. So you might have heard about these guys a lot during COVID-19, and they are pretty much the main people who are dealing with the many challenges and events involved around our disease control. So, some of the different ways that we can control the spread of disease is by administering things such as antibiotics. So, they work against bacteria to either help kill or reduce their growth. We also have such things called antifungals, as they do, in fact, work against fungi, and we also have antivirals, which work against viruses. The other thing we have are antiseptics. So these kill microbes on the outside of our body. So this could be through alcohol use, boric acid, hydrogen peroxide, which you may know as bleach, and iodine. Ones that you might be more familiar with are disinfectants. So they're chemicals that work similarly to antiseptics, but are used on the surfaces, so floors, toilets, kitchens, and things like that. So you may obviously help clean the house, and you are doing so to, of course, for one, keep your house clean, but also to reduce the number of pathogens or microbes around. So, of course, you might use multi purpose spray, Ajax, all of that other fun stuff, and essentially they are able to oxidize and split open bacteria. So, of course, disinfectants are particularly important in hospitals and food industry just to make sure you reduce the chances of bacteria and pathogens spreading. And then finally, we also have quarantine. So, you might have heard about quarantine a lot. You may have also had to be quarantined during COVID-19, and it is an effective way of reducing the spread of viruses and pathogens. As you know, if you can try and keep the pathogen contained inside the person and don't let it spread to anyone, then hopefully you can stop its spread to others. Now, you might have remembered when we're talking about disease transmission and even things like the bubonic plague, vectors are usually the cause of a lot of different pathogens being able to spread to different people. So we've got here houseflies, mosquitoes, mites, fleas, or dogs or even foxes. And I've got a few examples here of some of the diseases that these different vectors may be carrying and then cause us to get as well. So, of course, we can look about controlling vectors through things such as sanitation. So that would be eliminating, small pools of stagnant water around the house because they do attract mosquitoes to breed in. Um, we also want to make sure that we practice good cleaning practices just to make sure that there's no food or anything around to attract things such as flies or even rats to be around in our house and contaminate anything that we've got around. And then, of course, we do want access to clean running water just to reduce the number of pathogens that might be present within that. Some of the more Obvious ways of being able to control our insects is through insecticides. So, of course, being able to use chemicals to kill our insects before they are able to um, get us, really. um, Other things that we can think about is barriers and traps. So, of course, repellents. So, of course, AeroGuard off, some things to kind of detract insects from wanting to land on us and bite us. Um, Mesh screens in windows and doors. So, of course, you may all have fly screens that are up and around your house. You may find in places such as Africa, it might be really common to see you might find that is really common to see our netting around beds. And we also look at a layer of oil on window sills, which is really interesting because this actually helps prevent larvae growing. Of course, for rats, you think about manual rat traps or even baits. But if you are someone who's got dogs and cats around and you don't want to risk baits, then just a good old rat trap will work. And also UV traps, so you might see those bright, glowing um, bug. I can't think lamps that zap them. Zap lamp probably. And then we've also got our biological methods. So these ones are really interesting. So, biological methods such as the production of sterile males. So, this is in relation to malaria and the spread of malaria. So, it's actually only the females who carry the uh, malaria parasite. So, what they're thinking about is trying to reduce the number of mosquitoes that are being bred by, creating sterile males who then go out and they're actually unable to produce any offspring. So it's very interesting. And then also another method is by finding predators of our vectors. So fish do in fact eat insects, so do frogs even. So, making sure that we're also careful about what it is that we're introducing. But anyway, before I say too much about that, as you may have noticed in the learning intention, it says to also discuss ethical implications. Now, I'm not going to do that in this video. What's going to happen is that you will be doing an activity in class that will allow you to explore this yourself in a little bit more detail.